Welcome back. I'm so thrilled to be able to introduce to you Dr. Debra Shiota, my goodness. Dr. Shiota received her MD in Brazil. She finished her doctorate in endocrinology and worked as an endocrinologist and later joined the medical affairs team in several other pharmas. More recently, Dr. Shiota started as a senior global medical director at Ascendus in New Jersey, where she focuses her work on working with hypopara awareness and management. Today, Dr. Shiota is going to be sharing on patient report outcomes in hypopara, measuring the humanistic burden. So without further ado, Dr. Shiota.
Hi, good morning, everybody. It's a great pleasure being here with you. So sorry, I had some problems too. I do hope that you can see me now. So thanks a lot for the HPA members and the board. It's a great pleasure to be here. And I would like to share with you some thoughts concerning what patients really feel having hypopara, and if we as physicians and endocrinologists, if we can really understand what are your needs and how you are feeling during the treatment and the management of the disease. So today I would like to talk to you about your experience, the burden of the disease, and the huge range of symptoms, signs, and severities that you have and that compromise physical and cognition with your disease. Very recently in the US, we had a web-based survey with more than 370 patients, adult patients with hypopara. And despite the fact that these patients have been treated more than 12 months, over half of them, they mentioned that they still experience fatigue, muscle pain, cramping, paresthesia, problems to focus, concentrate, anxiety, and etc. So despite being treated. So what we can see is that there is a kind of a missing. There is no disease-specific tools that would represent signs and symptoms in hypopara and translate this data to something more objective to physicians and researchers in order to help these patients to receive a better treatment. So the question that I have is, would it be possible for experts trying to develop something to translate everything that you feel every day in an objective way so that researchers and physicians can try to better manage the disease with you? Well, now I'm going to show you lots of things that unfortunately, you're very familiar with, right? So problems with anxiety, depression, fear of having calcifications in the central nervous systems. May I have some seizures in the future? Problems with my eyes, my skin is very dry, I may have a laryngospasm, I may have arrhythmias in my heart. And then other problems such as renal problems, all the muscle tetany, paresthesia, and also the problems that may increase my chance of having fractures, for instance. So we have lots of different names of signs and symptoms, but for the patients, what really matters is that you are suffering from physical and cognitive problems. It impacts your daily living, your psychological well-being, your physical functioning, and also very important social life and relationships. So as a physician, I'm wondering, most of my colleagues, general endocrinologists, they have many other diseases to deal with. And sometimes they feel kind of with the hands attached, because in specific case with hypopara, if the patient comes to my office with a serum calcium normal, urinary calcium normal, the patient is taking pills, calcium, the vitamin D, everything seems to be okay, but the patient doesn't feel well. Would it be because, I don't know, some problems in the family, the children, they are teenagers now, so it's kind of a difficult, right? From a physician's perspective, trying to translate and make all of these symptoms and signs that the patients have, trying to translate it into something more objective that I could evaluate now and see if with a different treatment, with a different approach, these signs and symptoms are getting better or worse after a while. So when I studied medicine a couple of years ago, we didn't talk about patient-reported outcomes, especially in clinical trials. We talk about lab tests, imaging, we talk about many other things that physicians and researchers are looking for in clinical trials, but the patient's perspective was always something put aside. But thankfully, things are changing, and also the FDA now has for a while some guidances for pharmaceutical companies in order to proceed with clinical trials, taking into consideration the patient's perspective. So by the FDA, the patients, they have to be instructed, educated about these patient-reported outcomes that we are going to use in a specific clinical trial, as well as the investigators. And they also need to understand how to avoid missing data and how to kind of keep the data and transform this data into something meaningful for the medical population. So by the FDA, when we develop a patient-reported outcome, there are some steps. Just to simplify, I would say that we have to do our literature research and review. We do also need experts' opinions, and most importantly, the patient's perspective. After we gathering all of this stuff, we do interviews, for instance, with the experts, with the patients. Sometimes we have to transcribe these interviews. We have to evaluate what is really important for the patient. So the major signs and symptoms related to the disease. And also we need to do a correlation. What these signs and symptoms would be translated or would impact in patients' lives. Besides that, we also need to make sure that the patients, they understand that we are using the same vocabulary that they use to represent, to express themselves about these signs and symptoms, and see if the test is something that they really can do. And as a result, having these patient-reported outcomes, the questionnaire ready to go, our function is also to include these PROs in clinical trials and evaluate the results. Many of you may have heard about one quality of life questionnaire called Short Form 36. So as the name says, 36 is because there are 36 questions concerning different domains, dimensions related to physical and mental health, as you can see in the slide. The thing is that the short form 36, it's not specific for hypoparathyroidism. It's been used for many years, it's validated, and many diseases utilize this short form 36 to evaluate the quality of life in different diseases. But as I mentioned, it was not designed specifically for hypopara patients. So we came across with a specific patient-reported outcome that it's called HypoPARAthyroidism Patient Experience Scales. Between friends, we call it as HPAS. So what are the objectives of this HPAS? Our objective was, okay, let's try to develop some disease hypopara specific to measure signs and symptoms in patients with hypoparathyroidism and see if we can validate this PRO and use it further on. We needed then to develop a kind of a model and see if all of these signs and symptoms that we identify as most important for patients with hypopara, if we could kind of link these signs and symptoms to the impact that they have in patients' lives. And third, we also would like, okay, I mentioned to you about the short form 36, right? Should these HPAS be better, more specific to this specific patient population? Could our colleagues, physicians and researchers use this HPAS to really evaluate how the patient is feeling with a certain treatment? So these were our initial objectives. And as I mentioned before, and I showed to you, the FDA has all of the regulations and guidelines. So for the development of the HPAS, these guidelines were followed. Complicated, but not so that complicated because we had the help from the patients. So for the development of HPAS, we had interviews with 5 clinical hypopara experts and 42 adults with hypopara. And I'm very glad that many of you here, you participated, you supported us with your time and with your experience in order to develop these patient-reported outcomes. So it was possible to identify the major signs and symptoms of hypopara. We could also relate these signs and symptoms with the impact in your lives. We selected the most frequent ones and we kind of validated. We tested, see if the patients could recognize the vocabulary. Does it really translate what you feel day by day? And it seems that it worked. So here we have a summary of the characteristics of this population, these 42 people that helped us to develop the HPAS. So as hypopara in general, yes, we have most of the patients female, mean age around 53 years old, most of these cases post-neck surgery, and the duration of the disease, it's kind of there is a big range, but the mean number was 14 years. So again, with these FDA kind of guidelines, so we talked to the experts, we talked to the patients, and we could identify the major signs and symptoms for hypopara. Unfortunately, you know very well many of these signs and symptoms listed here as major, and we have the less common ones as we called minor for physical and also cognitive signs and symptoms. So in general, we could say that we found 17 most important or major signs and symptoms related to physical and cognition parts. What we've done after evaluating the 17 signs, major signs and symptoms, we try to correlate them with the domains, as we call it. So we have 4 different buckets. the physical functioning, psychological well-being, daily life, and social life and relationships. So signs and symptoms translated into these impacts. And also the other part of the study would be to evaluate in the long term what is going to happen. So physically speaking, cognitively speaking, economically speaking, because we do know how the disease impact the professional life, social life, the ability to be part of the society, and etc. So there is a huge impact. But people may tell me, oh, but come on, Debra, there are lots of different factors that may kind of interfere into this model. Yes, that's correct. So for instance, the age, the duration of the disease, if you have other comorbidities, for instance, hypertension, diabetes, your economic situation. So yes, there are lots of other parameters that could interfere into this model. So let's start with the signs and symptoms. So as I mentioned, we could identify physical and cognitive major signs and symptoms, 17 of them, and we prepared the HPAS symptom questionnaire. Okay, after identifying these signs and symptoms, we look for these patients and we ask them if they had and the frequency that they have these major symptoms. So here we can see that half of the patients, they have sleep issues, and almost 90% tingling, numbness, paresthesia. So it's not something that we should just kind of, okay, let it go. No, it's not let it go. And what we can see here in the lighter blue columns, we have what the physicians thought or mentioned about their patients complaining to them at the office about all of these symptoms and signs. So we can see that there is a kind of discrepancy, right? What you feel and what we as physicians think you feel. So these are the major ones. We had the less frequent ones, but what we can say, there is a huge range of signs and symptoms, physical signs and symptoms, where the patients with hypoparathyroidism, they are suffering, right? And these are the most common ones. I talked about physical signs and symptoms, right? So, but there is cognition as well. And cognition, oh, it's difficult for me to kind of understand the information. It's kind of a complicated thinking. I'm not very focused. It's difficult for me to continue a conversation. My memory, regardless the name, how the patients express themselves concerning cognition, we can see that the huge majority of the patients, they do have some kind of a compromising cognition part. And many of the patients, they refer as a kind of a brain fog. So we are aware that brain fog is a very, huge selection or innumerable different signs and symptoms that, okay, our head is not working as well as it should be. So I talked to you about the signs and symptoms, and what is important is not only the signs and symptoms, but how these signs and symptoms impact patients' lives. So here you can see with the darker blue, the physical functioning, in green, the daily life, the psychological well-being, the social life and relationships, the 4 buckets that I mentioned before. So taking into consideration the 17 major signs and symptoms, we could identify 26 major impacts of all of these signs and symptoms in patients' health-related quality of life. And again, for the impact of the signs and symptoms, yes, again, how long do you have hypopara, your age, your socioeconomic situation, etc. Of course, all of these factors, they also interfere in the way that the signs and symptoms interfere in patients' lives. So I mentioned these 4 big buckets, right? So just a kind of example, for instance, for physical functioning. So the question was, how much hypopara symptoms interfere with your movement, your walking, your exercises in relation to the psychological well-being? Feeling anxious, depression, angry, with the nerves, concerning daily life. And this is something that I must confess that for physicians, sometimes we think very much about, oh, yeah, I'm pretty sure that the disease is compromising my patient's professional life, focus, stamina, and etc. But sometimes we forget that there are some other more common stuff, regular stuff, dealing with things at home and that the patients are also suffering with. In addition, how these signs and symptoms are interfering with all of these daily activities that you have, what you do, you have to stop doing things because you're feeling this stuff. And for social life and relationships, and well, life is complicated. Relationships are complicated when we are healthy. So it's very hard to imagine for you patients with hypopara, with this chronic disease, how much the disease impacts the relations that you have with your partners, with your children, with your family, with professional colleagues, right? It's not easy. So coming back again to that FDA guideline, so okay, we identify the signs and symptoms, we identify the impacts, but the thing is, okay, but this test, this questionnaire is really going to work in real life. So we share with the patients and with the physicians the questionnaire, and with the patients, we made them fulfill the questionnaire to see if it really was a kind of related to their lives and if they could recognize themselves in those questions, right? So when we kind of interviewed these patients and we asked them, now I mentioned before the signs and symptoms, and now talking about the impact in physical and psychological well-being. Starting with the physical functioning, half of the patients mentioned that mobility, it was not okay, it's impaired. And 76% the patients were unable to exercise themselves. And yesterday I was just looking at the chat here, and I've seen somebody mentioning about exercise, daily activities, and yeah, so 76%, it's a number, but it's 100% for the person who suffers from it, right? And in relation to the psychological impacts as well, feeling depressed, I can hardly imagine when you were at home, isolated in COVID. So 62% here, it was not in the COVID times, and then anxiety, anxiousness, 81%. What about the daily life? And here is what I mentioned about how we as physicians, sometimes we don't realize some practical things that happen with patients, right? So we see here in the lighter green what we as physicians think about patients complaining, reporting to us the impacts of the disease in the daily life. So interference with work, 100% of us, we said that, yeah, I'm pretty sure that my patients, they have some negative impacts of the disease that affects their work productivity. However, if we go to the right side, unable to do things around the house, it's almost 80% of the patients. And only, I mean, we had a thought that only half. I mean, we didn't realize that it's something very common, right? And it really disturbs and compromises patients' lives. Things to do daily basis at home. It doesn't need to be something very specific, right? So yes, again, there is a huge wide range of impacts that these signs and symptoms cause into patients with hypopara. Social life and relationships. So needless to say, right? So almost 80%, they have some impairment, the ability to participate as they did before, as you did before, in social activities, social life. And at the end, okay, what we can do with this questionnaire? So I checked, it seems to represent what patients feel. It's something more objective, I can measure it. So for instance, I can provide the patients this questionnaire, the HPAS, for instance, with a treatment X, and I change the treatment, and a couple of weeks, months later, I can repeat the test and see if the patient, in a more objective way, is improving from their perspective or not. And I'm not talking about if the serum calcium is normal or is abnormal, because the disease, it's much more than the serum calcium, the urinary calcium, right? So this is the baby. In fact, this is just a copy paste. I know the letters are very small, but just to represent the HPAS concerning the questions that address the signs and symptoms. And for this part of the questionnaires, we had information that the patients spent around 4 minutes to do that. And we had different degrees for each of the questions. For instance, the first one, 1A, muscle cramping. So I never felt it. This question was related to the previous 2 weeks, right? I felt it occasionally, sometimes, often, or very often, or always. And for the symptoms and for the impact, differently from the short form 36 that I mentioned before, here, if you have a lower score, it means that you were improving. For the short form 36, higher scores, you are getting better. So here is the opposite. So this was the symptom. And then we had the impact, which has 26 different topics, and the same thing. Lower scores means that the patient is feeling better. And we do hope patients feel better. So to sum up, the validation of this kind of a patient-reported outcomes, especially those specific to the signs and symptoms of a certain disease, and now we are talking about hypopara, this is important tool that could help, that will help physicians and researchers to understand much better the patient, not only based on lab tests, right, or imaging, but really how the treatment and the management are affecting their lives. These PRO measures, they can support physicians to evaluate, is my patient really getting better or feeling better, or is this kind of a treatment more tailored to these specific patient needs? And with these PRO measurements, the physicians will also be able to kind of better identify benefit risks in a certain situation. Does it pay off to give a certain treatment for the patient? Because I know that it may help, but will it help? So the PROs, they are going to help us to kind of define it. And better understanding of the impact, the burden of the disease from a patient's perspective, yes, it's going to help us a lot in order to address the unmet needs that these patients have. And looking specifically patients. This could be a tool for the patients to express themselves and to support physicians who are managing, we're treating them sometimes for years and years, to better understand from their perspective how the disease impact, right? And sometimes we as physicians, oh my gosh, I'm not even going to ask patient Mary if she's feeling better about the fatigue or the cramps or something like that, because if she says to me, oh no, I'm not getting better, what else as a physician could I do? So it's a kind of it's a very tricky situation. And I'm so glad that I had this opportunity this time to kind of share with you. I'm just one endocrinologist, and I have here the lucky to have so great professors and colleagues giving all of these lectures. So it was just a sense, right, from a physician's perspective, trying to understand much better what patients feel with this disease. And we do hope that, well, all of the scores using the HPAS, for instance, or any other patient-reported outcomes, we do hope that you all feel and get better. Thank you.
Thank you so much, Dr. Shiota. Hi, everybody. I'm Neha Gandhi. I'm a colleague of Dr. Shiota's at Ascendus Pharma. I lead our patient advocacy, and we're so pleased to be here with you today. And what Debra, she mentioned during her talk, as we developed the HPAS, I loved how you said that, Debra, between friends, we call it HPAS. As we developed the HPAS, it was only due to your contribution and your effort that we were able to do that. So I will also just extend my thanks to you all. I'm going to help Dr. Shiota with some of the questions, and we'll make our way through those. And I thought this was a really good one to start with, Dr. Shiota. Is there a place where we can access the PDF of the HPAS, the form that you showed, for ourselves? Are you aware of where that exists?
Unfortunately, we don't have it in PDF, but the company is working on, and we are using, in fact, because I talked a lot, I know that, but in fact, we have very cute babies, because we are having some papers and manuscripts, just translating all that I mentioned very briefly to you. But yes, we are working, and we are going to work with HPA Association to kind of provide these questionnaires when we had all the approvals and etc.
Perfect. And this is a little bit related to that same question. It's a very good question. It says, can HPAS be used for other studies? It was mentioned that there was a new tool being developed for another competitor, another pharmaceutical company. So the question is, can the HPAS be used by others?
In theory, yes, because the questions, I mean, the signs and symptoms and all of these, the impacts, they are literally what you told the experts, the researchers, right? What was important for you. So, and I don't want to say, oh, this is the only one. No. I think that as many people are interested in supporting the patients and the physicians to better understand the impact of the disease into their lives, it's better. So yes, it's not specific for the HPAS, friendly speaking, it's not specific for one product, or it's the disease. We want to support the patients, that's it.
The next is actually more of a comment, and I wanted to share it with you. It said, thank you for encouraging physicians to pay attention to patients' daily quality of life. And I think, Dr. Shiota, you were so transparent and vulnerable when talking about your own experience treating and how you might shy away from things. So I think that that comment is really important, you know, just thanking you for encouraging physicians to think about that.
Yeah, I know that I'm not alone. I mean, there are lots of colleagues that feel the same thing. And you understand, right? I mean, nowadays with full offices, short period of time, and I understand that for many of our colleagues, maybe it's complicated to have a questionnaire for asking patients all of these questions. So that's why we are also would like, and Neha, if you allow me, and the HPA members and board, it's important for us to better understand as well how HPAS could also help you. How would be the ways that we could offer this tool and make physicians and patients' lives easier?
I think that's phenomenal. So those are in the works. Those are in the works. There are some questions here specific about NatPara and, you know, in terms of quality of life. And I just wanted to let you know, I do see these questions here, but we really are not able to answer questions about specific drugs, even our own, and the data that's associated with that. And I think it's been mentioned previously, but I wanted to let you know, as we are at the very preliminary stages of talking to the FDA about our submission for TransCon PTH, we're sort of in a very quiet period with regards to our speaking about our data publicly. So I just wanted to let you know, I do see those questions, but unfortunately, we are not able to answer them. I'm going to go up to a question that Debra, I'm not sure if you can answer, but I feel like it's a very interesting question. It says, can you speak to how having some parathyroid tissue, very low PTH, versus no parathyroid issue, PTH0, could impact symptoms and treatment?
Oh, definitely. If you have some tissue remaining, in theory, you wouldn't need, instead of 100%, right, PTH replacement, you will need maybe 80%, 70%. And the nature is kind of a very, I mean, it's very tricky. The nature tries to kind of compensate when things don't work very well. So definitely there may be, and especially concerning the duration, how long have you been with insufficient or absence of PTH? It is also, and how your receptors are more sensitive, more, I mean, hungry for the PTH hormone. All of these factors, they really may interfere with the clinical manifestations and the way that you are going to answer to the treatment.
Thank you. That was very helpful. This is a question I don't think you can answer, but I just wanted to make a comment and then let you make a comment. So again, about some questions about signs and symptoms compared to NatPara. I just wanted to say our trial did not compare to NatPara, so we don't have specific signs and symptoms comparison to NatPara. And I didn't know if there's anything more you wanted to say about that, Dr. Shiota.
I just wanted to, you know what, I just want that my colleagues and the patients are more aware of these kind of measures, right? More specific to the disease. And regardless the treatment, I just want as a physician that patients feel better. So let's hope that new treatments, new options come to the patients so that they can come back to their normal lives, right? Because they don't have normal lives, unfortunately, now.
I think this might be a good question to end on. And it says, Dr. Shiota, thank you very much for your validation regarding the exceptional impact HypoPARA has on our lives. And that's one of the main things that not only in from Ascendis's perspective with developing a therapy, but it was really, really important for us where we could help you speak your voice and help you amplify, what you've been saying to the community, to physicians. And one of those tools to do that was through the development of the HPEs. So I don't know if you have any closing words, Dr. Shiota.
Well, again, just wanted to say thank you very much for all the HPA members and the board. It's Saturday. It's a lovely Saturday morning, afternoon here, at least in Princeton. So thank you very much for your attention and the opportunity to talk to you.
Thank you very much. And we appreciate you all. Thank you for joining us today.
And I'd like to thank Dr. Shiota also and Neha for their presentation.